Hello, my name is Becky Sanders. I am the Upper Midwest Telehealth Resource Center Program Director, and today we are hosting virtual office hours for the UMTRC and entitled Ask the Experts. So I'm going to go ahead and share my screen. I've just got a couple of slides to introduce you to the Upper Midwest Telehealth Resource Center if you haven't taken advantage of any of our programs, webinars, workshops, or training sessions before. Again, my name is Becky Sanders, and I'm the Program Director for the Upper Midwest Telehealth Resource Center, or the UMTRC. So the UMTRC is one of 12 regional telehealth resource centers around the country, and we're represented here by the lilac states on this map. So Illinois, Indiana, Michigan, and Ohio. And you can see the other regions around the United States. We also do have two national resource centers. The Policy Center, the Connected Health Policy Center, serves as the National Telehealth Policy Center. And then TTAC, or the Telehealth Technology Assessment Center, is our next National Technology Telehealth Resource Center. Together we have a national website where you can find webinars. Currently we have 3 webinars each month. And there's a lot of information from each of the 12 telehealth resource centers, the 12 regional and the 2 national. It's all pulled together in that one page. There's also an interactive map that you can link out to any of the other centers. So here at the Upper Midwest Telehealth Resource Center, we kind of call ourselves virtual librarians. Especially with COVID, so much of what we do is virtual. People reach out to us via email, via phone, through our website, and we answer a lot of individual questions about telehealth reimbursement, best practices, workflow, licensure, those types of things. We also do a webinar series each month. We host 2 podcasts each month. Our podcast series is the newest thing that we've released. And the first and third Fridays of each month there's a new podcast. You can get to that through our website, and you can also find it on your favorite podcast platform. Just search for A Virtual View. Today there's one of our virtual office hours where we do Ask the Experts and Introduction to the UMTRC on a monthly basis. If you go on the event page of our website, you can see our workshops. We held our first day-long virtual workshop back in February, and we held another one earlier this month in March. There'll be one in April and one in May, and leading up to our annual conference that we're going to be hosting in person in South Bend, Indiana in July. All that information can be found on our website at umtrc.org. We are also putting the finishing touches on our training center and demo center. So when things open up a little bit more with COVID, hopefully over the summer after our conference, we will be able to host training sessions in our offices in Indianapolis and allow folks to come in and try out the different technologies that we have. As a federally funded organization, we must remain vendor agnostic. So we've got like 3 different digital stethoscopes, 3 different digital otoscopes, those types of things. So you can try out different variations of the same product, and we can remain vendor agnostic in that. There's my contact information. I'll go ahead and put that in the chat. And now's the time I'm going to stop sharing and see what kind of questions our audience has today. So what prompted you to join today's office hours? And what questions do you have? Are your programs currently using telemedicine or telehealth to reach out to patients? What organizations do you represent? What states do you come from? Thank you, John Henry. Are you practitioners or support staff, mid-levels? What role do you play in your organizations? So we've got someone from Michigan representing a number of practices, and Michigan Department of Health, see many but not all of our diabetes education programs are utilizing telehealth. I've done a series of trainings for the Indiana Department of Health with their diabetes education series and hosting that. It's very interesting how that has come around. I can't remember off the top of my head if diabetes educators and nutritionists in Michigan can bill for telemedicine with Medicaid. I don't remember. A lot of states opened that up and added that. Some states have opened up lactation for those folks that have their IBCLC. I think that's what the abbreviation is. Yeah, but there's lots of opportunities to offer educational information via telehealth. Yes, that's kind of what I was thinking maybe. So registered dietitians and registered, is it just RNs, registered nurses, can bill for Michigan Medicaid. So that's good. Any other comments or anything you want to say? Yes. When Medicare and Medicaid do have different policies, I will say, when Medicare and Medicaid have different policies, it can be confusing because the billing for one vendor or one payer is different from a different payer. So sometimes that can be confusing. Any additional information you want to share or anything you'd like to learn about today? How did you learn about today's virtual office hours? I'm curious, we've been using a lot of different platforms, social media platforms and newsletters for outreach. I'm curious how you found out about today's session. Via email? Okay. All right, so does that mean you're all signed up for our newsletter? Did you get it through our newsletter? Just sent via email?
Yeah, I got it through the newsletter. This is John.
Great. Thank you, John. All right. Well, we are currently accepting speaker proposals for our annual conference in July and hope to wrap that up here in the next week or so, and then have a draft agenda and registration open for vendors and for attendees sometime mid to late April. So we will certainly feature that in our newsletter that's coming out in a couple of weeks. I look forward to hopefully seeing you all in person there. So far, all of our speakers that have submitted proposals have not had any travel restrictions. So we do hope to hold the event in person in South Bend. All right, if there are no other questions, then we'll go ahead and end today's session. I wish you all sunshine and happy weekend, and enjoy.
Thank you. Have a good weekend.
You too.